Hello and welcome to this fourth video in a series dealing with gestational diabetes, and this may be the most important one. Please remember, none of this is individual medical advice. In previous videos I've tried to be a bit lighthearted and even, made a few probably very bad jokes, and I'm dressed like an idiot, but that's only in the interest of anonymity. But I'm saying this because in this video there's absolutely no place for any lightheartedness, because this video is dealing with the very difficult topic and the sad topic of stillbirth and infant deaths up to 1 year of age. Specifically, I'm going to raise in this video, possibly for the first time, and you can say this is speculative, I'm going to ask whether treatment with diabetes medications in gestational diabetes mothers may be contributing to the deaths of some babies. Now, I must state at the outset, there's no criticism at all for individual doctors or midwives. They're acting in good faith, doing their best for the mothers, the expecting mothers under their care. But their practice is governed and restricted by directives and advice and guidelines from expert groups, which they have to follow. Now, as I go through, I'm going to flick up copies of studies. Please look at these to support what I'm saying. Okay. Now, stillbirth, or the death of a baby, or an infant, is an inexpressibly awful, terrible thing, and I can't even imagine what it's like for the parents, but also for the grandparents and the extended family, and even for the medical staff. So this video is going to discuss, firstly, small size, and I'm going to put up copies of studies as I'm speaking, but it's well recognised that small size or restricted growth in a baby, particularly below the 10% level, is associated with an increased risk for stillbirth, including and also newborn or infant death, possibly related to insufficient nutritional supply, which is mostly glucose, the supply from the mother to the baby across the placenta. Have a look at these studies. Secondly, we will look at how deaths are occurring in small growth-restricted babies, even while at the same time the mother is being given or prescribed or asked to use drugs, diabetes drugs, to further restrict the growth or nutritional supply of the baby. This is not common knowledge, or at least it's not commonly acknowledged. The situation of these babies attracts no expert commentary. It was drawn to my attention in a 2023 study from Australia. This study showed that in Australia, babies of gestational diabetes mothers who were in the lowest 10% and even the lowest 3% for growth, and therefore at significantly increased risk for stillbirth, a third of these babies who already had a fragile placental supply were having their nutrition further restricted with the use of diabetes drugs. I don't know about you, but that strikes me as a pretty dangerous practice. And for all anybody knows, this could be happening everywhere. And it's not just a theoretical thought bubble. In a private communication with the authors, they said that in their 6-year study, in their database, unpublished, 1 or 2 babies every year below the 10% mark for growth had died while having their growth restricted with diabetes drugs. And the study authors also pointed out that if you look hard enough, which of course no one does, you'll find examples scattered in the literature, incidental, unremarked, unnoticed, of babies less than the 10% level for size dying while having their nutrition and growth pharmacologically restricted. Here's some examples. In this study, a 36.5-week baby, less than the 10th percentile, died while having its growth restricted with insulin. In this study, a 38-week baby, less than the 3rd percentile, at high risk, died while its mother was being prescribed metformin. And in this study, 3 babies' deaths were caused by intrauterine growth restriction, while at the same time their mothers were on insulin, a medication which restricts growth. Consider these facts. As has been said, it's well known that babies in the bottom 10% for size are at significantly more risk for stillbirth, but also for deaths up to 1 year of age. Higher glucose levels in the mother decreases the chance of the baby being in this small at-risk group, and this was clearly shown in the famous Harper study. In contrast, low glucose levels as a result of gestational diabetes treatment or the use of diabetes medications for any reason may increase the number of babies in this small at-risk group. Have a look at these studies. Importantly, it's not just the bottom 10%. For at least 3/4 of babies, right up to the 75% level, 3/4 of babies, a decrease in birth weight is associated with an increase in the incidence of stillbirth. Unfortunately, the gestational diabetes paradigm is so strongly focused on the perceived, but unproven, I might add, need to decrease the growth of the 5 or 10% of large babies, that potential collateral damage to the majority of smaller babies by simultaneously decreasing their nutrition and growth is not even on the radar. And here we're only talking about death. In a later video, I think I will, look at potential effects of restricting intrauterine growth on future life and health. But finally, let me make a comparison with smoking. In a comprehensive review of preventable factors contributing to stillbirth, Flenity and co-authors commented that cigarette smoking is a preventable contributing factor to 2,800 stillbirths per year worldwide, a contributing preventable factor. By my back-of-the-envelope calculation, and you can do this yourself, if 25 million women in the world are diagnosed with gestational diabetes, and that seems to be the case, and if 10% of their babies are lower than the 10% mark, and if a third of those babies are having their growth slowed or restricted by nutritional deprivation with the aid of diabetes medications, it may be that, just like smoking, gestational diabetes treatment is also a preventable contributing factor in over 1,000 babies' deaths per year worldwide. And of course, as more women are diagnosed, presumably more babies will be in this position. Well, you can make up your own mind what you think about this. Leave a comment if you feel like it. Thanks for listening.